Whoa. Hey guys, what's up? So, I'm here to tell you guys about cyclothymic disorder, or cyclothymia. Cyclothymia is a type of bipolar disorder. Cyclothymia represents a chronic cyclical pattern of mood disturbance characterized by mild mood swings, lasting at least 2 years for adults and 1 year for children and adolescents. Cyclothymia usually begins in late adolescence or early adulthood and persists for years. Rarely, periods of normal mood last for more than a month or two. However, the periods of elevated or depressed mood are not severe enough to warrant a diagnosis of bipolar disorder. Although cyclothymia may be the most common of the bipolar disorders, it tends to be underdiagnosed in clinical practice. The person fluctuates between periods of ups and downs. When they are up, people with cyclothymia show elevated activity levels, directed at accomplishing personal projects. But, when their moods are down, they may leave their projects unfinished. Then they enter a mildly depressed mood state and feel inactive and depressed, but not to the extent typical of a major depressive episode. According to the DSM-5, there are 6 diagnostic criterion. Many investigators believe that multiple causes acting together contribute to the development of bipolar disorders. Evidence points to cognitive deficits in people with bipolar disorder in recognizing facial cues of emotions in others, deficiencies that appear tied to abnormalities in the workings of the brain's prefrontal cortex and limbic system. Brain imaging studies find supporting evidence of abnormalities in many regions of the brain, especially those involved in processing emotions. Studies state that rates of bipolar disorder are increased in children with one bipolar parent compared to offspring of parents who don't have the disorder. And if both parents are bipolar, rather than just one, a child is more likely to develop the condition. The genetic link does not mean that one bipolar parent, or even 2, will necessarily produce a bipolar child. Other factors, including stressful life events, abrupt changes in sleep patterns, and chronic medical illnesses, can contribute to a person's risk. Investigators are also learning more about the role of psychosocial factors in bipolar disorder. For example, social support from family members and friends can enhance the level of functioning of bipolar patients by providing them with a shield against negative effects of stress. Moreover, the availability of social support appears to play a role in helping speed recovery from mood episodes and reducing the likelihood of recurrent episodes. The DSM-5 does not specify treatment options for cyclothymia. The use of mood stabilizers, such as lithium carbonate, and anti-seizures or anticonvulsants, together with cognitive behavioral therapy, or CBT, as well as support groups, can manage symptoms. Support groups can emphasize medication compliance and coping with symptoms. Anyway, I gotta get back to work. It was nice talking to you though. See you around.